Hi, I'm Matt Collins, and today I'm going to be demonstrating the insertion of an intraosseous needle using the Easy IO gun.
Firstly, let's start with indications for IO. During cardiac arrest and where there will be a delay to IV access. Where intubation is indicated and sedation and paralysis pre or post intubation is required and access to IV is not possible or is delayed. Difficult IV access in the deteriorating or time-critical patient, and in kids where delayed IV access in a deteriorating child when there has been 2 or more attempts at IV or it is taking longer than 90 seconds, as per the Royal Children's Guidelines. Following on from this, contraindications for IO insertion include any part of the limb that is traumatized or infected, the proposed site cannot be adequately cleansed, osteogenesis imperfecta, which is a genetic condition where bones break easily, an attempt in the same bone, i.e. if you go distal tib, you cannot go proximal tib. Manufacturing contraindications also include orthopedic procedures at insertion site, prosthetic limb or joint, which is pretty self-explanatory, and excessive tissue and being unable to cite anatomical landmarks. Just like IV access also has 5 rights: the right site, the right needle, the right lignocaine administration, the right flush, and the right amount of pressure. Just like any procedure, IO also has its complications. These include necrosis of the surrounding soft tissue due to extravasation, infection of the bony tissue, and can be painful in the conscious patient. The most common of these complications is extravasation, and this can lead to compartment syndrome. This arises when the IO is not placed in the correct position, and when fluid is administered to the patient, it fills into the calf, leading to compartment syndrome. Other complications also include growth plate injuries in the pediatric patient. There are 4 sites for intraosseous insertion: the proximal tibia, the distal tibia, the proximal humerus except in newborns, and the distal femur for peds. The proximal tibia is the most common IO insertion site, and this skill will be the one I'll be demonstrating today. For pediatric insertion, 1 to 2 centimeters proximal to the most prominent aspect of the median malleolus and palpating the flat part of the tibia bone. For pediatric insertion, secure the leg outstretched to ensure the knee does not bend. The insertion site is 1 centimeter proximal to the superior border of the patella and 1 to 2 centimeters medial to the midline. For pediatric insertion, have the patient place their hand over their abdomen with the elbow adducted. Palpate the humerus towards the shoulder until you feel the surgical neck. This will feel like a golf ball on a tee. Where the ball meets the tee, this is the surgical neck. Insertion site is 1 to 2 centimeters above the surgical neck on the most prominent aspect of the greater tubercle. There are 3 IO needle sizes: a red 15mm for the ages of less than 12 and a weight of 3 to 39 kilos, a blue 25mm for an adult of greater than 40 kilos, and a yellow 45mm for an obese adult.
Firstly, before the insertion of an intraosseous needle, I need to prepare all my equipment. Firstly, I need to make sure I have all my PPE. My goggles, I've got my gloves on, and I've got my sharps container. The equipment required that I have set up are a normal saline bag, primed, and hanging in a pressure bag. I have my Easy IO gun. I have my needle chosen for the right size and for the right site. I have my extension tap, which is primed. I have my securing tape. I have my swabs. I have some tape, and I have some normal saline flushes drawn up. So for this demonstration of inserting an intraosseous needle, I'm going to use these scrumptious chicken drumsticks that I got from Woolworths. The use of a drumstick is a good idea because it's the most realistic example of putting an intraosseous in other than a real person. They provide the muscle and the soft tissue and the fat around the bone, and you can easily identify the tibia inside the chicken drumstick and then feel for these landmarks. To locate the proximal tibial IO insertion site, I come below the patella, which isn't on this chicken drumstick, but I find the tibia tuberosity, which is just distally from the patella. I locate that, and then I come 2 centimeters medially, and I find a flat section of bone just here on the tibia. Now for AV, they say to come back approximately 1 finger width or 1 centimeter or the manufacturer for the EZ-IO state just to go on this side just here. So tibia tuberosity, 2 centimeters medially, and then that's your site, or 1 finger width up, and that's your site there, just on that flex section of bone. Firstly, I need to prepare my site. I'll grab my alcoholic swab, swabbing the site from the inside to the outside in outward circles. After I've done that, I grab my EZ-IO drill and my blue needle, which I've chosen for my chicken drumstick over there. I attach it to my drill, removing the cover, calling sharps out at the same time. Prior to swabbing it, I've already marked it and ready to go. I push the needle through the skin until I hit the bone at 90 degrees to the bone. I make sure that I've got 5 mils of the needle at least above the level of the skin, or at least 1 black line, and if I haven't, I go up in size on the needle. I pinch the skin and I drill until I feel a loss of resistance to insertion, removing my drill. Unscrew the needle, calling sharps out and placing in the sharps container. Once I've put the needle in, I attach a 10 ml syringe and aspirate the needle. Once I've done that, I attach my securing device over the top like so, and pulling on both sides. Next, I grab my extension tubing, screw it into the needle. Once I've placed my extension tubing, which I've already primed, depending on the patient that I'm putting the intraosseous needle into, if they are unconscious, I can simply just flush the line with 20 mils of normal saline of crystalloid for adults, or 5 to 10 mils for pediatrics. But if I've put my intraosseous needle in a conscious patient, I need to prime the extension tubing and flush lignocaine into it. I need to use 0.5 milligrams per kilo for adults and peds. For adults greater than 30 kilos to a max of 40 milligrams, and for peds less than 30 kilos to a max of 20 milligrams. Once that's done, I grab my bag of normal saline, which I've primed and placed in a pressure bag. And I attach it to the extension tubing. Like so. Once I've done that, I take the extension tubing to the leg of the human, or the chicken in this instance, and I'll tape down the extension tubing to the leg of the human also. And to show that the needle is in the right place, I can attach my 10 ml syringe with some normal saline here, and I can just flush through, and you can see all the bone marrow coming out through the ends. Thank you for watching my demonstration of intraosseous insertion into a chicken drumstick.